Should you worry about taking antidepressants? Should you be concerned about side effects? And most importantly, should you be worried about the fact that they might increase the risk of suicide? Welcome back to my channel and thanks for watching. For those of you who have not had the pleasure of meeting yet, I'm Dr. Tom Cordell. I've been a doctor for over 20 years and I started this YouTube channel because I have a passion for making sure that people can live the healthiest lives that they possibly can, and I wanted to help you with the information you need to try and sort out the competing and conflicting information that you will find out there online, so that you can live your best, healthiest life possible. Today we're going to talk about SSRIs, or selective serotonin reuptake inhibitors, which are a type of antidepressant. Now, these are quite topical because there have been a number of stories in the UK media recently about these drugs, and also an awful lot of us take them. They're really commonly taken. Probably around a third of adults will take an SSRI at some point in their lives, and they can be really, really useful drugs. Now, the reason why I've chosen to make this video is that I'm a little bit concerned that the narrative in the public discourse at the moment is such that it might discourage people from taking SSRIs, when in fact they can be really effective treatments for mental health problems like anxiety and depression. They can really be a game changer, quite transformative for patients who suffer from these conditions, and in some cases they can in fact save lives. So I think it's really important that we have the right facts so that we can make the best decisions about how we treat ourselves when we are suffering with mental health conditions. The first unfortunate story that has been in the media in the UK recently was that of poor Thomas Kingston, who was the son-in-law of Prince and Princess Michael of Kent. Now, he very sadly last year took his own life after having been treated for anxiety with an SSRI antidepressant. And the coroner who conducted the inquest into his death was very concerned that there might have been an impact from the SSRI. In fact, concluded that the SSRI was what caused him to take his own life, and has demanded of medical authorities that they revise the guidance surrounding the use of these drugs when treating people with them. The second important bit of public discourse that has occurred has been really more in the realm of politics, and very important people such as Wes Streeting, the Health Secretary, and former Prime Minister Tony Blair have gone on record as saying that they think that people are being overdiagnosed and overtreated with antidepressants, and this has led to some criticism of the medical profession for perhaps giving us drugs that we either don't need or that may even cause us harm. That begs the question, what should you do if you go and see your doctor with a mood disorder like anxiety or depression, and they suggest to you that you might like to try treatment with an SSRI? Well, I think it's really important, first of all, that you have all the facts at your disposal. And I want to address the arguments that have been made in public about the use of SSRIs one by one. The first is there's this concern that SSRIs cause suicide. Now, I want to be absolutely clear with you. There is no evidence whatsoever that SSRIs cause suicide. It's really important to remember when we're talking about this, the difference between causation and association. Now, causation means that we have developed an understanding of a mechanism by which one thing causes another thing to happen. Whereas association simply means that we've observed that when one thing happens, another thing tends to happen as well. Of course, it doesn't mean, simply because something is associated with something else, that that something is causing that something else. So we know that there is an association in a certain group of people between SSRI use and suicidal thoughts. However, in that group of people, we're giving them an SSRI because they're depressed, and depression causes suicidal thoughts. So there's a significant confounding factor that may be confusing us and making us think that SSRIs cause suicidality, whereas in fact, it's the underlying depression that causes it. Why then, you might ask, did the coroner in the Thomas Kingston case express such concerns about SSRI use? Having sat there and listened to all the evidence, why did she think that we need to change the way that we use these drugs? Well, my answer to that is that she was only looking at one person, and one person does not constitute good evidence that should inform how we treat medical conditions across a whole population. It's simply not science. You wouldn't expect your doctor to say to you that you couldn't have a treatment just because one person in the world had suffered a side effect from it, would you? And this is the same principle. We know that all drugs have side effects and that using any medical treatment is about balancing the risks versus the benefits. One of the reasons why I decided to make this video is that I have extensive clinical experience of using these drugs in many hundreds, if not thousands of patients over many years. And I've got a million different stories that I could tell you about the benefits that people have realized from using these drugs. Whereas on the other hand, I haven't had a single patient who's had a serious side effect. And the side effects that my patients do tell me about tend to be relatively mild and short-lived. So they tend to be things like a bit of a dodgy tummy that lasts for up to a week or two. At the milder end of the clinical spectrum, these drugs can mean that people simply have a more enjoyable, fulfilling life, and it can be quite transformative, increasing their energy, increasing their motivation, meaning they can go back to work, look after their kids better, have a better relationship with their other half. And at the more severe end of the spectrum, they can interrupt the suicidal thoughts that lead some people to sadly take their own life, and then in that case, they're effectively life-saving. The other talking point at the moment is the political narrative that doctors are overdiagnosing mood disorders and over-treating them. Now, the reason why people like Tony Blair and Wes Streeting are talking about this is that they're worried about the welfare budget. They think that a lot of people are declaring themselves unfit for work because of anxiety or depression, and that that's costing the country billions of pounds in benefits. Well, they do have a point, but that's a political discussion and not something that I want to get into. But what they fail to take account of is the fact that there are hundreds of thousands of people in this country who are struggling with their mental health. And there are an awful lot of things that people can do themselves to improve it, lifestyle interventions, which I'll talk about in other videos. But we know that SSRIs can be a really useful tool in the toolkit to help those people feel better. And if we can get those people back to work, if we can get them parenting better, if we can get them staying in their relationships, then those are all things that are good for society. So what should you do if you go and see a doctor with a mood disorder and they suggest to you that an SSRI might be useful for you? Well, my advice would be to give it a go, because there's not an awful lot to lose. The side effects are generally quite mild, and you might find it really quite transformative.